Welcome to U.S. Elections Week 4 and 5. Last week I didn't do a video, I just sent an email for you to watch the final presidential debate, which was Thursday night. I just want you to do the same thing you did on the last one, just an evaluation of how you think the debate went, what you learned about each candidate and what they say they're going to do if they're elected, how they handled themselves, how they presented their information, just their behavior in general, who you thought made the better case, and who you thought won, just your general opinion, just like before. It was the final one. It was a lot better than the first one. It was what a debate should be like. They acted like grown-ups. They didn't interrupt each other too terribly much at all. They gave, Biden gave, politician answers, and Trump gave Trump answers. And sometimes they deflected when they were asked a difficult question. They deflected and turned it back on their, opponent. That's the word. So it was a lot better. That's how a debate should go. So watch that and then send me an email just like you did last time of your opinion. Last two times, the presidential and the vice presidential. Okay, so we are going to talk about the two state questions that are on the ballot this year. I think that a lot of times when people go to the polling place, they are prepared to vote for the president and vice president. They're prepared to vote for a governor. I don't think people go and are necessarily prepared to vote for judges or sheriff or court clerks or any of those kind of things. I think that we have a tendency to only focus on the big one. But state questions are the big ones. State questions affect our Constitution, our Oklahoma Constitution. Oklahoma is one of 11 states that when a citizen-initiated amendment is made to our Constitution, the legislature cannot alter it or get rid of it. It has to go back to a vote to the people, and that's a lot harder to make happen than for them to just make an alteration or a change. So once we vote on something and it passes, it's basically permanent. So we have to be really, really careful on these state questions that they are what they seem to be. And that never happens. You cannot take them at face value. You cannot walk into the polling place and say, oh, I'll make my decision when I'm there. I'll get in there and I'll read the wording of what this state question says it's going to do. Because obviously they want them to pass. So they say them in a way that makes them sound better or leaves out some important information. It just really generalizes it. And sometimes it makes it sound like it's the complete opposite of what it is. You really have to research state questions every single time before you go vote. Every single time. So, for instance, in June, we voted on state question 802. These are complicated, so I do have notes, and I might even have to look at my phone to look at those. When you're researching these, we're going to put links in this stream, in this feed, that go to a few different websites that will have pros and cons of each of the state questions, and then it will tell what people for it are saying, what people against it are saying, what its general wording is, what it will do to our state constitution, that kind of stuff. But there's several of them, and it's important that you look at those and make decisions. You guys are almost old enough to vote. You need to learn how to interpret these state questions now. There's a lot of adults that don't know how or don't care to. It's very, very important because it does alter our future. So right now, you guys need to look at these websites. You need to look at all the wording, not just one, but all of them, because they all have a little bit of different information in there, so that you learn how to interpret these state questions. It's very, very important. So back to in June, we voted on state question 802, which expanded Medicaid. Okay, if you don't know, Medicaid is the state-funded health insurance. So it's for people on the poverty level, way below the poverty level. These people do not have any money at all. I hear people say things like, oh, I wish I got free Medicare, or free healthcare or whatever. But this isn't an extra amount of money people are getting. It's all they have. So it's expand. The vote was to expand it some. Okay. It passed barely. And it sounds good. Help poor people have health insurance. Help poor people's children have health insurance. It sounds like a good, great thing. The problem with it was there was no plan. The plan was just expand it so more people had an option for it. But there was no plan. We don't know how it's going to be funded. There was no plan. So it barely passed, and it's mathy stuff. So it passed, and let me look at my notes and maybe I can tell you what it said. All right, so the Medicaid expansion passed. It will cover people from 18 years old to 65 years old that are 133% below poverty level. Except the expansion, with the Affordable Health Care Act, there's a 5% disregard of income. So it reads that it's 138% below. So it just covers a little bit, it didn't make a giant change. But when you're talking about money and people, it's a lot bigger change than it seems. For instance, an individual who made $12,490 qualified, and now an individual who makes $17,236 a year qualifies. And before, a family of four that made $25,750 qualified, and now a family of four who makes $35,535 qualifies. You guys are young. $35,000 might sound like a lot to you, but to support a family of four, that's not very much money at all. At all. So it expanded it a little bit, but not a huge amount. Again, the problem is they didn't have a plan to pay for it. Some people say that there was a plan. I don't see any real wording that shows there was a plan. I think that State Question 814 will help pay for it. I think that's the idea, and I think that that's how they're presenting passing State Question 814. Some people say that 802 is already paid for through the taxes on medical equipment and taxes, money provided for medical professionals, the insurance they have to pay for. There's people that say it's already paid for, but I don't see any real evidence that it's already paid for. And I think that's part of how they're promoting 814. So 802, we've already passed barely. Expanded Medicaid, so a lot more coverage for people who don't have money. Okay, so back to 814. 814 is about an endowment that the state of Oklahoma gets. In 1998, several states and several of our territories, Washington, D.C., Puerto Rico, basically sued the tobacco companies. You guys are all too young to know this, but used to, when you drove down the road, when you see those great big billboards that are advertising like Toyotas and Amazon and whatever, the great big billboards on the highway, those had tobacco ads on them. Magazines had tobacco ads in them. Television had tobacco ads. It was everywhere. People on TV smoked cigarettes all the time. They showed in movies the youth smoked, the adults smoked, everybody smoked. In 1998, the tobacco companies were sued and lost. And one of the things was they could no longer advertise where it could influence the youth of America. And so a lot of the money was given to these states. It was 46 states, 4 territories, Puerto Rico, and the District of Columbia. I'm not sure why they point out Puerto Rico outside of those 4 territories, because Puerto Rico is a territory also, but whatever. It's an endowment, which means it's basically a trust fund. So every year, Oklahoma gets a payment for that. And right now, 75% of that payment goes to smoking, keep people from smoking, help people stop smoking, educate people against smoking, health research on the effects of smoking, and 25% of it goes to the state legislature, and they can decide how to use that 25%. So right now, 75% goes to get rid of smoking and to treat people who have smoking-related illnesses and research on that. 25%, the state gets to decide what to do with. This 814 is going to flip that. So 25% would go to education, research, health treatment, those kind of things. 75% would go to the state for the state to decide how to use that money. This endowment is called Master Settlement Agreement, MSA, Master Settlement Agreement. It's annual payments, which means once a year. It's a public trust called Tobacco Settlement Endowment Trust, TSET. I don't know how they say that, but anyway, it provides all those things I said, but they are promoting that 814 will cover the cost, or the majority of the cost, for the Medicaid expansion that was approved in State Question 802 in June. So they're saying 814 will cover the majority of the money we're going to spend on this expansion. Passing, let's see, the MSA payment in 2020 was $75 million. If we pass 814, okay, so it's $75 million. So this year, 18 million 75, whatever. About $18 million went to the legislature to decide how to use it. $56 million, a little more than $56 million, went to the tobacco settlement. Okay, so to provide health care, health-related research, prevention of youth, that kind of stuff. I know that when my kids were little, they went to a project that was called Project Power, and it was through the Oklahoma City Indian Clinic, and it was a grant that they got, and the initiative was to teach them healthy lifestyles, and it was about exercise, nutrition, and non-smoking. And so they got part of that grant came from this endowment. So I know that it's used a lot, especially with the youth. And so this year, that they spent $56 million on that, and $18 million went to the legislature. But if it passes, as 814 passes, that's going to switch. So then from now on, if the payment is $75 million, then $18 million would go to the healthcare industry, to education, to research, that kind of thing. And $56 million would go back to the state legislature to decide how to spend it. They are saying that they would spend it on this Medicaid, on what we passed in 802, the Medicaid expansion. But there's no wording that I can find that says they will for sure do that. When you read it, it doesn't say that they're going to spend all of that 75% on the Medicaid expansion. It says that they could spend it on that they can decide how to use it. It would go to the legislature instead of to the trust. So are they really going to spend it on the Medicaid expansion? Maybe, maybe not. There's nothing to hold them to it. But if we pass it, it's in our Constitution and it can't be changed, at least not easily changed. This also affects our rural communities. Okay, so the Medicaid expansion helps the rural communities because a lot of the rural communities have a lot of people in poverty. So that the 802, if it's expanded, it's going to help with doctors, nurses, medical equipment, medicines, going, maybe a school nurse, the local doctors. That's going to help provide medical care for a lot more people, not just in the cities, but in our rural communities. Yet at the same time, taking this money away in 814 from the research and the health care and prevention, that is also taking money away from those rural communities. Are they really going to give it back just in a different way? Or are they going to take it and the legislature use it however they want to? This one's really tricky because they're not really telling us that they're for sure going to use all of that percentage for the Medicaid. Also, the way it's set up right now is it's in this trust, so it's building interest. The 75% is in a trust, so it's building interest. And they're kind of using that interest. That's where those payments are coming from. And so we're building up a fund that can be used for that. But if the interest payments are on 25% instead of 75%, that's a whole lot less money that the state's going to get for these treatment plans, for these education, for research. So this one's really, really tricky because are they really going to do with that money what they're saying they're doing? I mean, they're completely flipping it. 75%, 25%, and then completely flipping it. It's not even like they're saying, oh, let's do 50%, 50%, and let's just be even. That's a huge shift, a huge change, especially when they're not laying out their plan. That's why these state questions get tricky. They don't lay out a plan ahead of time. So we don't really know 100% what we're voting on. So if you don't vote, it looks like you're a total jerk because you don't want to help people that can't afford health insurance. But if you do vote yes for it, are you being tricked? Is it really what they say it is? I don't know. It takes a lot of research. I can't make that decision for you. I'm not trying to influence you to vote either way or to make a decision either way. What I'm trying to do is influence you to do the research. You've got to look at the pros and the cons. You've got to do the research yourself. Okay. What they're saying is almost $40 million cut that they're going to make from the $75 million. It's almost a $40 million cut would go to Medicaid, maybe. They say that this Medicaid expansion from 802 could cost the state up to $164 million. $164 million for basically a 5% increase. That's a lot of money. 5% doesn't sound like a lot until you know what the real figures are. So the proponents for 814 say, we don't really need it anymore. We don't need that much to go to the education because the need has declined. We don't have as many youth smoking. We don't have as many adults smoking. We don't have as many incidents of health-related issues from smoking. And just so you know, in case you don't know, I know people think smoking causes lung cancer. It does. But smoking also causes heart disease. Smoking causes a lot of other health issues besides just lung cancer. So you have to look at all these other health issues, not just lung cancer. So in 2017, the state of Oklahoma as a whole was down 20% in smoking and smoking related health issues. Okay. 2017, Oklahoma was down 20% overall and 12.5% in the youth. So it looks great. It looks like our numbers have gone down. So that's what one thing proponents are saying. We don't need as much money because our numbers are going down. We could use the money in the Medicaid expansion and then we wouldn't have to raise taxes. But look at that. I mean, let's go back. If it's only $40 million we're getting and we need $164 million a year, that's a lot. That's still $120 million we have to come up with. So, then the opponents to it are saying, yes, our numbers were down in 2017, but we're still higher than the national average. There's still a lot more smokers and a lot more young people smoking and health-related issues in Oklahoma than the national average. So yes, we still need these. The number one cause of preventable death in the state of Oklahoma is still health-related issues, health issues related to smoking. So although our numbers went down, it's still a huge issue in Oklahoma. Number one cause of preventable deaths in Oklahoma are related to smoking. So do we really want to take that? I mean, we really want to take that money away? I don't know. It's a difficult question because, we got to look at how it's affecting the rural communities. If we move that money away and put it somewhere else, if we move that money away and give it to the state government, are they really going to use it the way they say they are? But how are we going to pay for this Medicaid stuff? It's very, very complicated. I really want you to go and do the research with these links. Look at all of them. Read them. It's complicated. You're going to have to take notes. And then I need you to tell me what you think. What do you think? Do you think that we should vote for it? Do you think that it should not pass? And why? I want details of why. I want your pros and cons of State Question 814. What do you think the pros are for it? What do you think the cons are for it? And how would you vote? Okay? That's part of your homework. So the first step is your analysis of the final presidential debate. The second one is State Question 814. Do the research, give me pros and cons, and how you personally would vote. And it's okay if after you do all that research, you're still confused and you can say, I'm still undecided. But I want you to do the actual research and give me the pros and cons. I need to know why. Pros and cons, how you would vote, why you would vote that way, even if you're undecided. I need to know why you're undecided. Okay? The final state question, there's only 2 on the ballot this year. It's State Question 805. It is taking away what is called enhanced sentencing. So basically what it's saying that it does is for non-violent convicted felons or future convicted people to be convicted of non-violent felonies, is that they cannot have what's called enhanced sentencing. So that they will, if they're caught with a non-violent offense, felony, then they can only be sentenced to what the law says is the maximum for that offense. Okay? Right now, for non-violent crimes, if you have a second offense, they can do enhanced sentencing, which means if the offense of, and I don't know, if you break into someone's shed or garage and the sentencing is from 1 to 3 years, if you did it a second time, you could get up with enhanced because it's a second felony. with enhanced sentencing, you could get up to 10 years. And then a third time, it goes up again. And then some of them have what's called 3 strikes and you're out. If you commit a third felony, then you're done. You go to jail forever. It's a life sentence. So it sounds like a great thing. It sounds like, I mean, you know, I don't want people breaking into my house. I don't want people stealing my stuff. But if they do, I don't think that they necessarily need to go to prison forever, even if it's the 5th or 6th time they've done that. Yeah, I'll send them to prison and give them some therapy and I don't know what, but I don't necessarily think someone needs to go to jail forever for breaking and entering. I don't think someone necessarily needs to go to jail forever for having a little bit of, you know, marijuana or drugs on them. Now, I'm not talking about drug trafficking or a whole bunch of drugs or, you know, I'm not saying that people should do though. I'm not saying people should use drugs. What I'm saying is if it's nonviolent, should they go to jail forever? I don't think so. Okay, so right now we have expanded sentencing in Oklahoma. If you commit a second nonviolent felony, you can get more time than what's the maximum time for that crime. If you commit a third one, you can get more time for what's the maximum time for that sentence. Okay? So what 805 does is it would get rid of enhanced sentencing. So if you break into someone's house and you get 3 years, then if in 6 months you break into someone else's house again and you get caught, you get another 3 years. I mean, 3 years after you get out of prison. So there's it's not building up. Your punishment's not snowballing. It just stays the same all the time. So it sounds okay. It sounds like an okay thing to do. Nonviolent crimes. That's fine. I mean, whatever. Maybe, who knows? I mean, I'm not trying to influence. I don't even know how I feel exactly about that. But it sounds like not a horrible thing, okay? In Oklahoma statute, Title 57, Section, is that right? 571? I'll have to look those numbers up and make sure those are the right things. It lists what violent crimes are excluded from 805. Well, it lists what are considered violent crimes, okay? So if you want to look that up, you can. I'm sure it's a long list. I know that it's things like human trafficking, murder, kidnapping, rape, some really ugly things. So those things are not on this list. Those things are not being affected by the change of this law, by this amendment to our Constitution, our Oklahoma State Constitution. Okay, it's only what's considered non-violent crimes. Okay, the reason that they did this was they did an analysis, and they believe that reducing the prison population by 8.5% would save the state $45 million to $186 million, which would be a total of 27. Oh, that's by like 2030, I think, or 2035, just like a whole number. It's at a total of $27 million per year. If we reduce the prison population in the state of Oklahoma by 8.5%, then we could save the state $27 million a year. Okay, so that $27 million right there could go help the Medicaid fund, or it could help, mental health treatment. So, and that would be like for, drug addicts or, thieves or whatever, people with mental health issues, which a lot of the people in prison have mental health issues. So you could use that money for either one of those things. That would give us some money. So would you really still need 814? if you could save money by not having as many people in prison. I don't know. Except for 27 million and 40 million, still not the 100 and whatever million we need to cover the Medicaid expansion. I don't know. It's complicated. This is where 805 gets really complicated. It sounds like it's not a horrible thing. It sounds like nonviolent, why do nonviolent criminals need a life sentence? I don't know. Some of them do. So the people who are for 805, they believe that the state of Oklahoma, with our enhanced sentencing, are handing out unfair and cruel sentences. They think that a lot of times it's just completely unjust. It's over the top. The state of Oklahoma uses enhanced sentencing 80% of the time when it's an option. 80% of the time. So most of the time when it's an option, we use it here in Oklahoma. So it could save us a lot of money to not house as many people in prison for as long period of time. If they're not in prison, the taxpayers are not paying for that. So that's one reason that people are for it, is it would save us money in the state that could be used other places. So here's a couple of examples of people, and I hear these same three over and over and over. They use these same three examples. I would like to hear some other examples. But these three examples of people who have enhanced sentencing or have had enhanced sentencing that seem very extreme. One person had a second offense of breaking and entering into a shed, and they got a life sentence. They did it twice and went to prison for life. It does seem a little excessive. One person got 33 years for writing $400 worth of bad checks. That seems a little excessive also, especially since a lot of mental health experts, psychologists, psychiatrists say that, a lot of people say they write bad checks because they have to support their family and they didn't have any money and they need to feed their family, but $400 is more than just feeding the family. A lot of the mental health experts say that writing a lot of hot checks is a symptom of a mental health disorder. So, instead of 33 years, maybe a shorter sentence with mandatory mental health treatment. I don't know. What do I know? Then another one is someone received 15 years for stealing basic necessities for their children because they couldn't afford them. Well, that sounds excessive, especially now that person's children doesn't have a parent in the home to help in any way to provide those basic. And now the state's also paying for those people to be in prison and probably paying for those children to be in foster care. So we're spending money all over the place over that. So, I don't know the answers. It's too much for me, but I do know that these are some examples of enhanced sentencing being used to the extreme. Okay? It's not always used to the extreme. And sometimes we need those people off the streets. But not necessarily permanently. When you're talking about crime, every situation is different. It's really hard to generalize crime. But Oklahoma has greatly overcrowded prisons. We hand out some of the longest sentences in the country. When people in Oklahoma go to jail, to prison, they go to prison for longer than people in other states, whether it's violent crimes or nonviolent crimes. So we are really handing out some long, harsh sentencing. So if 805 passes and nonviolent criminals do not get these enhanced sentences, that would really reduce in theory, reduce our prison population. Okay? So you get all that. That's the pros. Will it really reduce our prison populations, or will these people be repeat offenders and go right back to prison? I don't know. They're people. Who knows what a person's going to do? What a group of people's going to do? Maybe somebody goes to prison one time for 3 years and they're like, dude, I'm out on that. I'm not doing that again. Maybe they go and they're like, prison ruined me. I'm doing it more. I don't know. So in theory, our prisons wouldn't be overcrowded if we don't do the enhanced sentencing. But I don't know. Maybe they'll just be repeat offenders over and over and over and over again and keep going back and back and back to prison. I don't know. They don't know because we haven't done it yet. Okay, so now we're going to talk about the cons of 805. Okay, so although there's no formal campaign against 805, I have seen Governor Stitt speak out against it, and I have seen a few other people speak out against it. I have a person that I know from high school. We've stayed in contact all of these years, and she has worked for the district attorney this whole time, and she works with people that are victims of domestic abuse, and she speaks out against this. And so when I started hearing her speak out against it, I thought, I need to relook at this, because they promote it as it's just going to be people who are nonviolent criminals. So people who get caught with some marijuana or break into a shed and steal some tools, but they don't hurt anyone. It's fine. It's fine. 3 years, 5 years, whatever, but no life sentences because they're not hurting anybody physically. But that's not true. So the people who are against it are saying that it's really bad for victims. It's saying that the victims don't matter. They don't. If you are a victim of these crimes, that you don't matter. Public safety. The more times someone breaks into a house, supposedly, research shows that the more bold they get, that possibly then it could lead to violent crimes. I'm not an expert. I don't know. I'm not saying these things are absolutes. Again, person to person to person to person is each person's different. So I don't know. But that's what some of the cons are. And then the other thing is back to we're amending the Oklahoma Constitution by a citizen initiative. And when you alter the Oklahoma Constitution by a citizen initiative, the legislature cannot alter it or strike it down. So if we pass it and it's a bad plan and these people get more and more bold and become violent because they're getting away with these crimes, then it's going to be really hard, almost impossible to change. So we always have to be careful when we're voting to amend our Oklahoma Constitution. Okay. What they don't tell you is what is on the list, what constitutes a violent crime in the state of Oklahoma. You might be surprised what is not on there. I'm sorry, I know some of you are young and your parents may not want you to hear this, but you guys are going to grow up and vote, and this is important, and your parents need to hear it too. 3 things, I don't know what all's on there, but I know 3 examples of things that are considered non-violent crimes in the state of Oklahoma that will not be covered as violent crimes. They'll be non-violent crimes, and if people repeat these crimes, they will only get a maximum of like 3 years. So 3 examples are domestic abuse by strangulation. So if a husband or a wife or a parent or a child strangles someone in the family, they can only be sentenced to the maximum of that crime. That's not a violent crime according to the law in the state of Oklahoma. That is violent. That is a violent crime. But according to the law of the state of Oklahoma, it's not a violent crime. They're going by what was in this statute that I talked about earlier on January 1st, 2020. So whatever was on that list, January 1st, 2020, is what would be considered violent or nonviolent for State Question 805. If 805 passes, whatever was on that list January 1st, 2020 is considered nonviolent or violent. At that moment, domestic abuse by strangulation was not considered a violent crime. Sexual battery was not considered a violent crime. A DUI with great bodily harm was considered not a violent crime. All three of those things are violent. All three of those things greatly alter the victim's entire lives forever. That they never recover from those things. So why are those considered non-violent crimes? I don't know. But if 805 passes, those things, people can do those things over and over and over, and they're not violent crimes. Now, I do need to stop there and say that in May, they added some more things to the list of violent crimes, but they're not on that list from January. So if 805 passes, it's my understanding that they will not be considered violent crimes. Most of the domestic abuse is missing from that list in the state of Oklahoma. Most of domestic abuse is not on the list of violent crimes in Oklahoma. 4 more were added in May, but they're not on that January list. So, domestic abuse will always be treated as a first-time offense because it's considered most of it's considered a nonviolent crime. So, this 805, that sounds innocent enough. You got to do your research. Is it really, really innocent? Doesn't sound so innocent to me. I mean, if it was breaking in my garage, that's one thing. If it's some yahoo down the road smoking a little weed, which I don't approve of, but I don't necessarily think they should go to prison forever. That's, one thing. But strangling someone, sexual battery, DUI with great bodily injury, great bodily harm, I mean, I'm telling you guys, those are violent things. They should be violent. They should be considered violent crimes. They should be on that list. Now, like I said, it's my understanding that some of them are on the list now. 4 more were added to the list in May, okay? But it's my understanding that only what was on the list January 1st, 2020 will be on this 805, if we pass 805. We can go to Oklahoma Statute 57, Section 5, I think it's Section 571, and see if that's on the list, if it applies to 805. But like I said, you've got to do your research. You have to, because this one sounds innocent enough. When you see the commercials, when you see the proponents for it, it seems innocent enough. But they're not talking about the violent crimes that are considered nonviolent crimes. Okay, so your homework for this week is to watch the presidential, your homework is from last week, watch the presidential debate, give me your analysis of it. Then I want you to look at State Question 814, look at the pros and cons. I want a list of pros and cons, what you think the pros and cons are, and then how you would vote, or if you're undecided, and why. And then on 805, same thing. List of pros and cons, what you think about it, how you would vote, and why. Okay? So those 3 things. We're going to put some links in the feed that where you can go and look this information up. And I think that is all. I would like to say that I know I mentioned some things in the 805 that, you know, are some touchy subjects because of violence and what it means. And I think there's a couple of kids in this class that are younger, and I apologize for that. But I will also say that in the description of my class, it says that I will talk about the truth of things, and sometimes the truth is hard to hear. And I apologize if you now have to have some discussions with your kids, but this is in this ballot that we're voting on this year, and the young people need to learn how to discern these things. I always am very prayerful before I vote on anything. I'm prayerful before I do the research on these things, because it is, sometimes we deal with some really difficult things here. You know, the state question 814, I don't think that's it, voting one way or the other is a moral question. It's just, which one do you think would be more beneficial to our state and the people in our state and the healthcare system? But 805 is, it's very, when you start to really look at it, it becomes very difficult. You've got some moral things going on there, and you have some emotional things that you have to deal with, some unpleasant things that you have to think about. So I apologize for that, but that is just part of this flawed world that we live in. And if you have to talk to your children about it, or if you young people have questions for your parents about it, I just would recommend that you go into it as a family and pray about it and discuss it with discernment, and know that whenever we come together and we pray and ask for guidance and healing or anything, that God is there with us, and that his word stands strong and it will never fall to the ground void. And so in these difficult situations, we can always lean on him for help, and he is faithful to help us. So that's what I have to say. And hopefully maybe next week we won't be canceled and we'll get to see each other again. All right. Thank you guys.